My name is Quach. I am a myeloma specialist and I work at St Vincent's Hospital, Melbourne in Australia, and I'm a professor of haematology at the University of Melbourne in Australia. So today I'd like to talk about the data I presented on the long-term follow-up of the Monumental 2 study phase 1B. And this is a study that explored a combination of drugs, Talquetamab, together with pomalidomide for heavily pretreated patients with multiple myeloma. Now, Talquetamab is the first in its class of a drug called a bispecific T-cell engager. And this drug is an immune drug. Think of it as a drug with 2 arms. One arm binds to the myeloma cells on a target called GPRC5D, and then the other arm binds to the immune T-cells called CD3 and marries the 2 up. And so the T-cells, having not recognized the myeloma cells before, is seeing myeloma for the first time. It gets excited, so it eats up the myeloma cells. So that's Talquetamab. We combined Talquetamab with pomalidomide, and pomalidomide is very commonly used drugs. It belongs to a class called immunomodulatory drugs, and pomalidomide has a capacity to enhance T-cell activities in general, as well as making the myeloma cells commit suicide, so direct tumoricidal effect. So you can see there is a biological rationale of why the combination would be very effective. So in the Monumental 2 study, phase 1B, or part 1B, we enrolled initially 35 patients, and these 35 patients were quite heavily pre-treated. They had on average 3 prior lines of therapy, and some patients had as many as 12 prior lines of therapy. And around 3/4 of patients had exhausted all options, and they were what we call triple class exposed or refractory, which meant that they've had an IMiD, a proteasome inhibitor, and an anti-CD38 monoclonal antibody. So they were bad prognostic patients. And in this study, Talquetamab was given through the skin. It was given at a dose of 0.4 milligram to 0.8 milligram, 0.4 milligram every week, and 0.8 milligram every 2 weeks. And we combined it with pomalidomide, which was introduced at their second cycle. At 2 milligrams, and then we escalated up to the tolerable dose of about 4 milligrams eventually. And treatment was until disease progression. And in this study, with a long-term follow-up of now 20.7 months, we saw that the results that we initially reported remained very strong. That is, we saw an overall response rate of over 85%, and people who achieved a very good partial response, that is a 90% reduction in their myeloma burden, was 80%, which is remarkably high, and people who achieved a complete response was around 45% of all of our patients. And with this longer-term follow-up, the people who responded remained responding, so the median duration of response was not reached. And the median progression-free survival was reached at around over 28 months, so that's quite remarkable. And in terms of safety, remarkably, we saw no new safety signal, and importantly, there were no people stopping treatment because of side effects, and so therefore we know that with longer follow-up, there is no cumulative toxicity. And so overall, this long-term data of Talquetamab and pomalidomide demonstrate that this is a very tolerable combination and very effective combination, and it reinforces our earlier report, but more importantly, it really supports our ongoing phase 3 study of a Monumental 6 that randomizes patients to either pomalidomide and Talquetamab versus the investigator's choice of elotuzumab, pomalidomide, dexamethasone, or bortezomib, pomalidomide, and dexamethasone. And so I think overall the data is highly encouraging, and I think this inspires much optimism for the future of myeloma.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference. and we're deeply grateful for your support.